Hello, this is Dr. Adam Wilson providing a narrated self-study of the course and distribution of the facial nerve. To begin, we'll review the embryology of the second pharyngeal arch. Then we'll explore the distribution and function of the 5 branches of the facial nerve. We'll discuss how to localize lesions of this nerve, and lastly, we'll review the autonomics it conveys that are responsible for salivation and lacrimation. Around the 5th week of embryonic development, 5 of 6 pharyngeal or branchial arches fully develop and are separated by pharyngeal clefts. Specific cranial nerves are associated with each pharyngeal arch. The mandibular branch of the trigeminal nerve, V3, arises from the first arch, for example. The focus of this self-study is the facial nerve, derived from the second pharyngeal arch. Unlike the peripheral nerves of the body, cranial nerves are unique in that they carry 2 additional fiber types. You are already familiar with the 4 main fiber types they convey: GSA, GSE, GVA, and GVE fibers. In addition to transmitting these fibers, cranial nerves carry special sensory afferents. As their name implies, these axons transmit information about the special senses, including olfaction, gustation, vision, hearing, and balance. Another unique feature of cranial nerves is that they carry branchial efferent fibers. These motor axons innervate the skeletal muscles that are derived from the same pharyngeal arch mesoderm that the cranial nerves themselves originate from. You will see examples of this in just a moment. Each pharyngeal arch contains neural crest cells and mesoderm. The rendering in the upper left of the slide demonstrates how the neural crest cells migrate to the pharyngeal arches from the developing brain. From the neural ectoderm of the forebrain, neural crest cells migrate to the first pharyngeal arch. From the neural ectoderm of the midbrain, neural crest cells migrate to the second and third arch. From the neural ectoderm of the hindbrain, neural crest cells migrate to the fourth and sixth arch. Neural crest cells within the pharyngeal arches eventually form the structural and neurological components of the face, including nerves, cartilage, tendons, bones, ligaments, and the dermis of the skin. The mesoderm of each arch will form the muscles of facial expression, muscles of mastication, and muscles within the pharynx. Not only do the neural crest cells of the second pharyngeal arch form the facial nerve, but they also give rise to bones and ligaments. In blue is Reichardt's cartilage of the second pharyngeal arch that gives rise to 3 bony structures. It gives rise to the stapes, a small bone in the middle ear cavity. It also gives rise to the styloid process, extending from the temporal bone, and gives rise to the upper body of the hyoid bone, including the lesser horn. Spanning between the lesser horn of the hyoid bone and the styloid process is the stylohyoid ligament, which is also derived from the second pharyngeal arch. While these structural and neurological components of the face come from the neural crest cells, the muscular components are derived from mesoderm. All of the muscles shaded in pink come from the mesoderm of the second pharyngeal arch and are innervated by branchial efferent fibers of the facial nerve. In addition to the muscles of facial expression, there are 3 other muscles that are derived from the second arch. They include the stapedius muscle in the middle ear, as well as the stylohyoid muscle and the posterior belly of the digastric muscle, which are found in the neck. Now let's turn our attention to the nerve derived from the second pharyngeal arch, the facial nerve, abbreviated cranial nerve 7. The majority of cranial nerves originate from the brainstem, which is made up of the midbrain, pons, and medulla. Cranial nerves are numbered, using Roman numerals, from rostral to caudal, according to the order in which they emerged from the brain or brainstem. The facial nerve exits the brainstem at the pontomedullary junction, the area where the pons meets the medulla. As is typical, the origin of this cranial nerve is located near its associated nuclei in the pons, where the cell bodies of the neurons reside. The facial nucleus, for example, houses cell bodies of facial motor neurons, whereas the superior salivatory nucleus is the area from which preganglionic parasympathetic fibers arise for salivation heading toward the sublingual and submandibular glands. The nucleus of the solitary tract is where fibers for taste synapse with ascending tract fibers destined for the cortex of the brain. Lastly, the geniculate ganglion is located at the bend of the facial nerve within the facial canal, and it houses the cell bodies for the special sensory neurons of taste. Because these special sensory neurons are pseudo-unipolar, no synapses occur within the geniculate ganglion. After the facial nerve exits the brainstem, it eventually gives rise to 5 different branches. The nerves labeled 1 through 3 branch from the facial nerve within the skull, and as such are intracranial branches. The first branch is the greater petrosal nerve, which carries parasympathetic fibers to the lacrimal gland and mucosal glands in the nose and palate. The second branch is the nerve to the stapedius muscle that lives in the middle ear cavity and innervates the smallest skeletal muscle in the body. The third intracranial branch is the chorda tympani nerve, which carries parasympathetic fibers for salivation and special sensory fibers for taste. Once the facial nerve exits the stylomastoid foramen, it sends off a posterior auricular nerve, labeled number 4, and ends as the terminal branches that innervate the muscles of facial expression. Now let's take a close look at the specifics of each of these branches in order, starting with the greater petrosal nerve. On the left, the skull cap has been removed to expose the anterior, middle, and posterior cranial fossae. Along the petrous ridge that separates the posterior from the middle cranial fossae is the internal acoustic or auditory meatus that leads to the inner ear. The image on the right provides an X-ray vision view of the inner and middle ear cavity through the petrous portion of the temporal bone. The facial nerve enters the internal acoustic meatus along with cranial nerve number 8, the vestibulocochlear nerve. Within the bony canal, the facial nerve dilates at the geniculate ganglion, which houses the cell bodies for taste. Emerging from the anterior aspect of the geniculate ganglion is the first branch of the facial nerve, the greater petrosal nerve, which carries parasympathetic fibers destined for the lacrimal gland. The greater petrosal nerve exits from the facial canal via the greater petrosal hiatus. It then courses along the floor of the middle cranial fossa until it enters the foramen lacerum. Before leaving the middle cranial fossa, the greater petrosal nerve unites with the deep petrosal nerve to form the nerve of the pterygoid canal, also called Vidian's nerve. Unlike the greater petrosal nerve that carries preganglionic parasympathetic fibers, the deep petrosal nerve is formed from the internal carotid plexus, which is composed of postganglionic sympathetic fibers. Therefore, the nerve of the pterygoid canal carries both sympathetic and parasympathetic fibers as it courses through the bony pterygoid canal to reach the pterygopalatine ganglion that lives within the pterygopalatine fossa. This image depicts the greater and deep petrosal nerves forming the nerve of the pterygoid canal. Vidian's nerve enters the posterior side of the pterygopalatine ganglion that lives within the pterygopalatine fossa. Within this ganglion, the pre- and postganglionic parasympathetic fibers synapse, and postganglionic parasympathetic fibers are then sent out of the ganglion through the zygomatic nerve, of which a communicating branch courses superiorly to enter the orbit via the inferior orbital fissure. Along the lateral wall of the orbit, the communicating branch of the zygomatic nerve merges with the distal end of the lacrimal nerve that innervates the lacrimal gland. And so that concludes the story of how parasympathetic fibers, which originate in the facial nerve, make their way to the lacrimal gland to stimulate tear secretions. As the facial nerve courses within the facial canal along the posterior wall of the middle ear cavity, it gives off a tiny branch called the nerve to the stapedius muscle. This nerve innervates the stapedius muscle, the smallest skeletal muscle in the body, at just over a millimeter in length. The function of this tiny muscle is to stabilize the smallest bone in the body, the stapes, named for its stirrup-like shape. The footprint of the stapes sits against an opening called the oval window. when the stapedius muscle contracts, it dampens the vibrations of the stapes against the oval window. By dampening these vibrations, the stapedial reflex protects the inner ear from loud, self-induced, as well as externally generated noises. For example, it protects against the volume of one's own voice while yelling. If the nerve to the stapedius is compromised, preventing the stapedius muscle from contracting, hyperacusis can result, which is an abnormal sensitivity to everyday noise. The second muscle visible in this image is the tensor tympani muscle. It attaches to the malleus, the first bone of the acicula chain. The tensor tympani helps to dampen noises that are generated internally, like the noises generated from chewing potato chips, for example. It is innervated by a branch of V3, the medial pterygoid nerve. The third intracranial branch of the facial nerve is the chorda tympani nerve. It branches from the facial nerve just proximal to the stylomastoid foramen. The chorda tympani travels through the middle ear cavity and exits the floor of the cranium through the petrotympanic fissure. Upon exiting the petrotympanic fissure, it enters into the infratemporal fossa. In the lower left image, the anterior wall of the right middle ear cavity has been removed in order to visualize the relationships of the middle ear structures. The chorda tympani nerve emerges from the facial canal along the posterior wall of the middle ear. It then loops superiorly around the tensor tympani muscle that is attached to the malleus. The chorda tympani then descends at an inferior angle to exit at the petrotympanic fissure, which is not visible in this particular image. As the chorda tympani nerve exits the petrotympanic fissure, it enters the infratemporal fossa that is situated below the zygomatic arch and medial to the mandible. Within the infratemporal fossa, the chorda tympani nerve hitchhikes with the lingual nerve, a branch of V3, the mandibular nerve. As its name suggests, the lingual nerve is destined for the tongue. The chorda tympani nerve has two key functions. First, it carries the sensation of taste from the anterior two-thirds of the tongue. As an aside, recognize that taste from the posterior one-third of the tongue is carried by cranial nerve number 9, the glossopharyngeal nerve, and taste from the epiglottis is carried by the vagus nerve. As a reminder, the cell bodies for the taste neurons that are conveyed through the chorda tympani and the facial nerve are located in the geniculate ganglion. These taste neurons are pseudo-unipolar, so no synapses occur within the geniculate ganglion. The second function of the chorda tympani nerve is to carry parasympathetic innervation to the submandibular and sublingual salivary glands. The preganglionic parasympathetic fibers carried through the chorda tympani nerve synapse with postganglionic parasympathetic fibers in the submandibular ganglion that is often suspended from the lingual nerve. The postganglionic fibers then enter the submandibular gland, or they re-enter the lingual nerve to innervate the sublingual glands. Sympathetic innervation, which inhibits salivation of the submandibular and sublingual glands, is carried through the external carotid nerve plexus. In your studies of this material, use this slide as a way to succinctly summarize the parasympathetic pathways related to the facial nerve. Now that you understand the two main functions of the chorda tympani nerve, you can appreciate what would happen to the chorda tympani if it was compromised. Imagine that you are an otolaryngologist performing a stapedectomy to improve a patient's hearing. This type of procedure is performed in patients with otosclerosis. In patients with otosclerosis, the footplate of the stapes becomes fixed rather than mobile due to the calcifications that have formed at the footplate. By removing the stapes, a stapedectomy, and replacing it with a microprosthesis, hearing can be greatly improved because mobility of the prosthesis against the oval window is reestablished. Realize that the ossicles are the smallest bones in the body, and the middle ear cavity in general is very small. It's about the size of a dime. When a surgeon is operating in the middle ear cavity, the chorda tympani nerve can become stretched, which could cause the sensation of distorted taste, which is referred to as dysgeusia. Or the chordotympany nerve could become severed, which would cause a loss of taste to the anterior two-thirds of the tongue. Loss of taste is termed ageusia. Furthermore, a compromised chordotympany nerve would also result in decreased salivation due to the parasympathetic fibers it conveys. The facial nerve exits the base of the skull through the stylomastoid foramen of the temporal bone. This foramen is named because of its location between the styloid process anteriorly and the mastoid process posteriorly. As soon as the facial nerve exits the stylomastoid foramen, it sends off a branch posteriorly that tracks behind the ear called the posterior auricular nerve. The posterior auricular nerve is both motor and sensory. It provides motor innervation to two muscles of facial expression that live just behind the ear, the posterior auricular muscle and the occipitalis muscle. The sensory component of the posterior auricular nerve has a very dispersed distribution, but generally speaking, it innervates the posterior wall of the external auditory canal as well as the posterior skin of the auricle. Finally, the facial nerve ends in 5 terminal branches. After the facial nerve gives off the posterior auricular nerve, it immediately sends a small branch to innervate the stylohyoid muscle and the posterior belly of the digastric muscle, because those muscles also originate from the mesoderm of the second pharyngeal arch. As the facial nerve courses toward the anterior face, it passes through the parotid gland and divides into a temporal facial and cervical facial division. The temporal facial division gives rise to the temporal, zygomatic, and the upper portion of the buccal branch, while the cervical facial division gives rise to the lower part of the buccal branch, as well as the marginal mandibular and cervical branches. As such, all muscles of facial expression are innervated by the terminal branches of the facial nerve. To localize lesions of the facial nerve requires a firm understanding of the function and pathways of this nerve. To offer up an example, suppose a lesion occurred at the distal end of the facial canal. To keep things simple, we'll assume all downstream function is lost. The patient would therefore present with ageusia, loss of taste to the anterior two-thirds of the tongue, as well as present with decreased salivation. In addition, we would expect this patient to have unilateral paralysis of the facial muscles. Notice the patient would not experience an entire loss of salivation, and that's because the parotid gland, which relies on a different parasympathetic pathway, would still be functioning normally. Additionally, this patient would not experience a dry eye on the affected side because the parasympathetics conveyed through the greater petrosal nerve are still intact. By associating function with location, nerve lesions can be localized to a specific region of this complex nerve. Do take the time to practice localizing lesions of this nerve. This concludes the presentation on the course and distribution of the facial nerve. Thanks for listening and happy studying.